stretch. Mr Cameron insisted the funding would help achieve a 7-day NHS.
This is not about NHS staff working 7 days a week. It's about different shift patterns, so that our doctors and nurses are able to give that incredible care whenever it's needed. It's about key decision makers being around at the weekend, junior doctors being properly supported, and crucially resources like scanners up and running whenever they're needed.
Jane Draper there on the Prime Minister's speech. Well, Jonny Marshall is a GP and Director of Policy with the NHS Confederation. It represents over 500 health organisations, and this morning the Confederation published an open letter calling both for financial backing and political will. Dr Marshall, welcome. Prime Minister talked of at least £8 billion. It sounds like the NHS Confederation thinks it's going to have to be quite a bit more.
Well, when we talk to our members, they say there are some real pressures on the ground right now, and the only way they're going to be able to address those is if they can change the way they provide services to people. So we think £8 billion is the minimum, but how quickly that comes on stream over the next 5 years to support this change will be critical. How well social care is invested in, because there's a £4 billion potential hole in there, will be also critical. And also the investment in prevention and public health to ensure that less people require acute services. We've got to get all those right.
I mean, that's something the Prime Minister was talking a lot about, trying to kind of slowly changing the kind of whole approach to healthcare really in the country, in the hope that that will generate savings down the line. But presumably a lot of these pressures are more immediate. And you talked in the letter as well about political cover for potentially unpopular decisions. What is it you're seeking from ministers?
Well, I think it's important that the ministers are creating the right discussion with the public about the fact we need new types of services that better meet their demands, what actually matters to them, and then we can work with them locally to work out what the local solutions are.
And presumably what you don't want to see is what we have seen in the past, where government sort of has a policy that means in some places hospitals are closed in order to focus specialisms in regional centres or district centres, and then some of those politicians are on the picket lines protesting against the closure in their local community.
Well, we realise that the NHS needs to take responsibility, and our members recognise this in working with local politicians and the local public to understand the benefits of change. But we need to make sure that the rhetoric, I guess, that's occurring at a national level matches the sort of discussions that are taking place at a local level. Workforce, you've already alluded to, it's an critical part of the sort of seven day services.
We need to understand. Cameron said, look, 9,500 more doctors, 7,700 more nurses in the time the coalition was in government.
Yeah, and I guess we don't really know what the right numbers are, so it's really important we don't become a hostage to fortune, and we're really allowed to build new models of care around people's needs and then work out what the workforce is you need locally.
And is this 7-day-a-week NHS achievable, do you think?
Well, I think if we think of 7 days being doing everything we're doing at the moment, doing it the same for 7 days, then I don't think it is. I think 7-day working becomes achievable when we think differently, and we make sure we're thinking when particular care is needed and delivering it at the right place in the community as well as in hospitals.
Dr. Jonny Marshall of the NHS Confederation, thanks very much. There have been